I'm Shoaib Ahmed, PCN Clinical Pharmacist. I'm pleased to welcome you to our Seacroft Primary Care Network podcast. It's a chance for you to meet the people involved in your care and to have an insight into how practices work together to create the network. Today, we're meeting Hannah, our PCN Children's Asthma Nurse. Hannah, please could you introduce yourself to our viewers?
Yep, hello. So I'm Hannah. I'm the Children's Asthma Practitioner that works for Seacroft PCN. So I'm currently on secondment from the asthma team at the Leeds Children's Hospital. And before this, I worked on the children's respiratory wards from qualifying. So looking after babies, children and young people with a variety of respiratory problems. So I've only been within the PCN since March because this job role didn't exist before, but this great opportunity came around as a result of an approach from NHS England to basically try and reduce health inequalities, which basically means reducing any difficulties faced by children and young people living with certain long-term health conditions from areas from kind of a lower average income. And asthma, thankfully, is one of the 5 main health conditions within this approach, which is known as the Core 20+5. This great opportunity arose for me to come and start working within Seacroft with the aim of trying to improve outcomes for children and young people with asthma who are living within the area.
Can you tell me about the role of the Children's Asthma Practitioner within the PCN?
So the role is really varied, which actually I'm really enjoying. So I'll just go through a couple of kind of elements, if that's all right. So one of the aspects of the role involves myself as kind of a clinical specialist for children with asthma, doing targeted clinics for children and young people with asthma who are seen to be at an increased risk of having asthma attacks. So I've been inviting patients who are registered at the 4 practices within the PCN. So that's Park Edge Practice, Oakwood Lane Medical Practice, Foundry Lane Surgery and Windmill Health Centre. So I've been running searches and inviting those patients into clinic who are known to have asthma. So they've got a diagnosis of asthma, but they've needed potentially a recent course of oral steroids to help manage their asthma. They've recently been admitted to hospital or they've needed to go to A&E with their asthma. They're using a lot of their salbutamol inhaler to manage their symptoms, as these patients, like I said, are seen to be at a greater risk of having further significant asthma attacks. So it's important I get them into my clinic, try and go through all the education and try and get their asthma control a little bit better. So I'm really lucky in my role that my clinic slots are a lot longer than what a GP or a practice nurse would have. So this gives me a lot more time to get to know the patient and the family and really go into much more detail and provide education about their asthma control, make sure they understand the diagnosis that they have, which a lot of people don't sometimes, understand what each of their medication is and how it manages their symptoms and how they work differently. Make sure they're on the right medication devices for them and they know how to use them effectively. They know what to do in an emergency. And obviously I'm there to make any advice and changes if there's anything needed to try and get better control of their asthma symptoms. One main thing is I'd always make these decisions with the patient and the family, not for the patient, if that makes sense. Yeah. I also get involved with community events to try and raise the awareness of asthma kind of across the community as a whole, so not just the patients and the families that I see in the practices. I provide more kind of outreach support, so I'm providing support for the schools within Seacroft and the surrounding areas, and basically just to make sure that they have the right training and the right education on asthma and the right policies and practices in place so families and obviously pupils can feel confident that when they're going to school, if they've got a diagnosis of asthma, that their child is going to be kept safe and the staff looking after them know how to look after their asthma as well. I support other healthcare professionals within the practices who may have any kind of questions or queries about children's asthma. I also work closely with the children's asthma team at the Leeds Children's Hospital, so I can discuss any patients of concern and refer if we feel like that's the right pathway for them. those types of patients, we would be maybe having difficulties trying to manage their asthma within primary care, and secondary care have obviously got a lot more tests, a lot more kind of experience. There's a lot more medications that can be trialled within secondary care. So we've got that pathway to refer into the hospital should we need to for any children of concern. Finally, really, I've been working quite closely with Leeds City Council housing teams and other housing partners, and also Leeds City Council public health teams to try and develop pathways which will support children and young people living with asthma in kind of housing conditions which are maybe subpar. So if they've got damp or mould, or if they're living in highly populated areas, which are known triggers to worsen asthma control. So working with those partners to try and, like I said, develop pathways to try and help these patients that are living in those conditions.
Quite a varied role. How common is childhood asthma?
So asthma is the most common long-term medical condition in the UK, with around 1 in 11 children and young people living with asthma. So for you kind of children, young people that may be listening to this today, it's more than likely that within your classroom, there'll be at least another person who has got a diagnosis of asthma as well, which is, quite nice to know that you're definitely not the only one living with this condition. In the UK, the number of emergency admissions to hospital or A&E, how well controlled asthma is in general, and sadly the rate of death from asthma is one of the worst within Europe. And unfortunately, these figures are worse for our children and young people living in deprived areas. I think that's possibly because asthma is often seen as quite mild, and because it can be variable. Symptoms are well controlled sometimes, and then other times symptoms just kind of come on. So I think sometimes it's maybe a condition that's not taken as seriously as some other respiratory conditions. And maybe there's just not that general awareness out there that asthma is a condition actually that can be really serious, and it can lead to children, young people and adults becoming really poorly because of how serious an attack can be. Sorry, that's not a very positive kind of facts and figures to hear, but I think it's really important for everyone, healthcare staff, people living with asthma themselves, their families, their friends, school, and that everybody understands that it is really important that we try and get asthma care and asthma control much better. And we definitely can achieve this by making sure people have that awareness, they're educated about their condition, and patients are on the right treatment pathways for them to make sure that we're getting optimal control of their asthma.
What common challenges do families with asthmatic children face?
So I just touched on this slightly in the last question, actually. So I think one of the difficulties with asthma is that it's a condition that is what's called variable. So not only can the kind of presentation of symptoms be different for each child living with asthma, but it can also change for each person themselves. So symptoms can change over a person's life, but it can also change over the course of the day. And the triggers which make asthma control worse can change too. So this makes it a really difficult condition to manage. In addition, asthma can be exacerbated by things called aeroallergens, which you may or may not have heard of, but they're basically substances in the air which can worsen asthma symptoms. So things such as pollen, so grass or tree pollen, moulds, dust, animals, chemicals found in cleaning products, for example, can worsen asthma control and worsen asthma symptoms. As you'll be aware, these are often things that are unavoidable. So they're in the air, they're kind of wherever you go. So that can cause a challenge when trying to manage a child's asthma. And also, as I've referred to in one of the previous questions, again, I think families often don't receive enough education about asthma. So it can sometimes lead to them not having the right knowledge on how to manage their child's condition. And obviously, if they haven't been provided with the right information, the right training, the right knowledge, then it's going to be really difficult to get asthma as well controlled as it could be. Children can also miss time off school if their asthma is poorly controlled as well, which obviously if you're missing lots of time off school, that can have a negative impact on their learning, which, that can be really difficult for children and families moving forward as well. So that's why it's really important that schools are trained kind of appropriately, so that the outreach that I'm doing with the schools, that's why it is so important, so that families feel confident in sending their child back to school after a period of illness, and we can try and get better control of symptoms generally, so that their asthma's leading to less time off school as well.
So how do you collaborate with other services?
So as I outlined in one of the other questions, my job involves a lot of collaboration with other services, and it's really varied, which is fantastic. I work closely with the other staff within the PCN and within the practices, working together to try and improve what asthma care is offered to our patients and families within the practices. I link with the specialist asthma services at the Leeds Children's Hospital as a way of kind of discussing and getting advice for patients who may be struggling to manage their asthma within what's available and offered within primary care. Yeah. Again, as I mentioned, I've been working closely with the schools in Seacroft and the surrounding areas to try and get their asthma care better. And I'm just acting as a point of contact for them to get in touch with if they have any questions, queries, or require any kind of further ongoing training or support. I've worked with quite a few of the third sector organisations, such as charities, non-profit organisations, and like voluntary groups that are based within Seacroft. So that's kind of We Are Seacroft, LS14 Trust. And we've also got a initiative running at the moment trying to support our families with asthma, who we're working with Green Doctors and Care and Repair. So they all do amazing work providing support and activities tailored to the community. So involving myself in some way within these organisations within the community is a great way of engaging in the wider community and raising awareness about asthma and highlighting any kind of further ongoing support that could be needed within the community as a whole. And again, as mentioned, alongside the hospital team who are working closely together as well, I've been working with housing partners and members of the public health team to try and improve indoor and outdoor air quality, which in turn will improve asthma outcomes for our workload and patients as well. I kind of touched on this just before when I mentioned Care and Repair and Green Doctors, but this also involves a scheme called Heating on Prescription, which we're currently in the process of rolling out, where kind of vulnerable patient groups with low household income are offered with affording heating and offered advice and support on how to keep their homes warm over the winter period. And so these companies will go out and offer that advice and see if there's any changes that can be made to try and obviously keep the house warm over the winter period. That'll reduce how much damp and mould is going to be kind of present as well. So it's such an important scheme to try and keep our vulnerable patients safe. So we're really kind of advocating for this. So basically, collaborative joined up working is really valuable, and it's what makes my job kind of successful and as positive as it is. And yeah, without that collaborative working, we can't provide the best care for our patients without the help and support of a lot of others. So a bit like the Seacroft PCN logo, we're like cogs in a wheel. So every person brings something different to the table, and we couldn't function as well without one another. So, yeah.
Just coming back to the challenges families face with asthmatic children, are there any other resources to help parents better manage their child's asthma?
Yeah, so great question. So a lot of people don't know there's lots of resources out there, but there is a variety of resources out there for families and children themselves to access. So there's a great app which can be downloaded onto your phone or your tablet, which can help to manage and monitor asthma symptoms. So this app is called Asthma Hub, and you can download it for yourself if you're a teenager and you're kind of more in control of managing your own asthma symptoms, or parents can download it to help with their child's asthma. Also, Asthma and Lung UK, so that's a national kind of charity organisation that has a variety of resources tailored for children and young people and families as well to access. So that's a really great resource. It's probably got everything you can think of on there. They have lots of information on what asthma is, what triggers you might have and how to manage those, what to do in an emergency. And they have really fantastic demonstration videos on how to effectively administer medication as well, which ultimately is one of the main things about asthma. Your inhalers and your medications must be administered effectively. Otherwise, it's just not going to be having the effect that is desired.
Yeah.
For more local resources, so resources kind of local to us here and not just nationally, people can access the West Yorkshire Healthier Together website. So this not only includes information about asthma, but healthcare advice on other childhood conditions and illnesses too. So obviously you can access that, if your child's got a viral illness, if they've got a temperature, if they've got another condition, then there's healthcare advice on there about that. This is a really great resource because they ensure the information's accessible to all as well. So they do this by providing the options to translate the information to other languages. You can have an audio description of the page as well. So if you're visually impaired, and then you can get that audio feedback. And you can increase the font size as well. So anybody with visual difficulties, like I said, you can either get the audio feedback or you can increase the font size. Yeah. Other useful resources include Beat Asthma. There's a children's comic book. So for the younger children, there's a comic book with lots of kind of puzzles and things to work through, but it's an educational resource at the same time. Okay. That's called Asthma Notes. Ask About Asthma. So that's a national campaign that happens every year. It's already happened this year, but the resources you are able to access kind of from this year. It's got loads of information, blogs, videos, webinars, suitable for everybody. So not just for patients and parents, but for schools, for healthcare staff as well, to raise awareness about asthma. And for the years moving forward, if you do want to kind of keep up to date with that, it tends to happen in September as children and young people are returning to school. So within that week where children are going back to school, because that's when nationally we see a rise and, a spike in asthma admissions, acute attendances to A&E. So it's just trying to raise that awareness in preparation for that, really. But to all of these, I can provide the links to show who I'm sure will kindly pop these up in the comments if anybody would like to access them.
Yeah, we'll make sure to put the links to those resources in the description for the video. So that's great, thank you. So obviously a child's experience of asthma might vary depending on what their symptoms are. What can be done to help improve a child's experience of their asthma?
The main thing to take away from today's podcast, I suppose, is that trying to get the basics right will really help to improve asthma control. So the majority of people that I see, they've just not been given the right knowledge and the right resources to be able to meet those basics kind of at home. So the main important elements of asthma management. So number one would be ensuring that any preventer treatment is given every day as prescribed, even if you feel like symptoms are well controlled. So any preventer treatment, it works completely different to the blue inhaler. That is, the preventer treatment is what is helping to reduce any inflammation within the airway. So that's any kind of swelling, redness, soreness within the lungs, which helps to that's the medication that ultimately gets your asthma control much better. It never works straight away like the blue inhaler. It's when it's given consistently over time, that's when you start to see those benefits. So it's just important to remember that. So yeah, it can be really difficult to remember this medication, especially if you're living in a busy household. But I always tell my families simple steps, such as kind of setting an alarm in a morning and an evening to act as a reminder to give that inhaler or that medication, or administering it morning and evening when you're brushing the child's teeth, or linking it with mealtime. So breakfast time before they go to school and then evening mealtime. It can just help families get in that really good routine and in administering that medication twice a day as it should be. Second would be to have access to the blue inhaler at all times. So when you're out and about, at home or at school. But it's really important that we don't overuse this medication. So we would always advise to only use this as and when you have symptoms of asthma. So those symptoms are coughing, wheeziness, feeling tight-chested, any shortness of breath. So in terms of overusing that medication, the reason why we say that is because overuse of that blue inhaler can increase the risk of asthma attacks. So obviously it's a really important medicine to give if it's needed, but kind of routinely just going to it and grabbing it as a kind of, I think I need it, or as a precautionary measure, we would advise against that. So I suppose a little side note is if you notice that your child is needing their blue inhaler more than 3 times a week consistently, so if they've got a viral infection that week and they're needing it a little bit more, but then things go back to normal, that's okay. But consistently, if they're needing that blue inhaler more than 3 times a week, to us, that means that their asthma control is less well controlled as we would like. And it's important that we get that child in for a review to see if we can make any changes with their inhaler devices, what preventer treatment they're on, just to try and get better control of their asthma symptoms, really. It's important that every child with asthma has a personalised asthma action plan as well. So this is a document which hopefully you may have seen, but you might not have. It's a document which helps children, families, anybody caring for that child. It helps them to understand what to do if their asthma symptoms worsen, how much blue inhaler to give, when to get a GP review, when to call for an ambulance, call 999 in an emergency. Knowing how to administer inhalers in the most effective way will also help asthma control better. So I see lots of children who are not taking their inhalers via a spacer, or they're on devices that actually they've not been shown how to use properly. And actually that's going to limit how much of that medication is actually getting down into the lungs where it needs to be to help. So most children and young people will be using what's called a metered dose inhaler, so the normal squirty inhaler. These must be used with a spacer. So no matter what age you are, the most effective way to give that inhaler is through a spacer. Otherwise, the majority of that medicine, if you're using it straight into your mouth, will just stick at the back of your throat and not actually go down into the lungs where it needs to be. If it's not in the lungs, then it's not going to be helping with kind of get better control of their asthma. However, some older children might be on dry powdered devices or particularly different devices that you can use directly into your mouth. But it's important that you know how to use these effectively as well. So the demonstration videos that I mentioned in one of the last questions are a really good resource to access to watch that back. Your local pharmacist, if you pop into there, they'll be more than happy to kind of demonstrate how to use these, or obviously at an asthma review, make sure that that clinician is showing you how to use that inhaler effectively if you feel like you're not doing so. And then finally, last point really is making sure that your child has a review at the GP practice every single year. Even if you think that symptoms are well controlled, it's important that we still see them. And always, in addition to this, make sure that you get a review if you're concerned about your child. You think they're acutely unwell, or as I mentioned before, if they're using their blue inhaler more than 3 times a week. Yeah.
Thank you. That was very informative, Hannah. Thank you. Thank you for your time today, Hannah. Thank you to everyone for watching this podcast. If you enjoyed this, then please leave a like and share the video because it'll help us grow the channel. But thank you again, and I look forward to you joining us next time. Thank you.
Thanks, Shoaib. Thanks, everyone.